Now, to help us understand the science behind the headlines, we're joined by Dr. Emmanuelle Lecornet-Sokol, a nutritionist and endocrinologist specializing in diabetes and metabolic health, who consults pharmaceutical companies like Novo Nordisk, which produces Ozempic. Emmanuelle, thank you very much for joining us. First of all, can you briefly explain what does the drug Ozempic do inside the body to treat type 2 diabetes patients, and who should and shouldn't be taking this drug?
Yes, so this kind of medication, it's called GLP-1 agonist, and they have three actions in the body. First, they are going to help to reduce the insulin resistance on the pancreas. Second, it's going to help to decrease the sensation of full stomach. And third, it's going to act on the brain to help to decrease the hunger, the appetite. So it's the first time in history that we have medication that help people to decrease the appetite without any many side effects.
So the attractive part of Ozempic is its rapid weight loss effects. But when weight drops this quickly, we surely aren't just losing fat, we're also losing muscle. So what are the long-term health risks and side effects of this drug, and are we still learning about them?
That's a very interesting question. So actually, not all people lose weight very fast. So they can lose from 15 to 20% of their weight, but it can be very slow for some people, and for some people there is resistance for weight loss, and some other people will lose quickly. And so that's why it's very important to have a very balanced diet, to keep having a physical activity, and to have a medical assistant with you. It's not something that you can take alone just like for a few weeks. It's really a long-term treatment, and you have to follow a good medical pathway to have good effects on your health.
And how would you say must we manage the rebound effect, or the so-called weight gain, which could come after coming off this drug? And what could happen to the body if we try to cycle on and off of this drug?
Yes, it's a very important question. So we've had some very recent medical studies, and these studies show that when people stop the medication, they are going to regain the weight. So currently, all recommendations, all experts say that we have to take for a long term this medication. And it's probably something that will be thought and that will be tested on other medical studies to see how things will be for people who need to take this medication for a long term, because not only it has an effect on the weight, but also on other organs in the body. For example, it can help people to reduce sleep apnea, or to reduce their cardiovascular risk when they already have a stroke, for example, or if they have a hepatic liver disease. So that's why it's important to keep probably the treatment for long term.
And Ozempic has exploded into mainstream cosmetic weight loss. Since it's relatively accessible, are we looking at a global health risk by allowing such widespread off-label use?
Well, I guess doctors are very, very careful about the way we prescribe it, and we try to never use it for aesthetic use. So it's important to say that there are several medications. For example, Ozempic and Trulicity are only for people with type 2 diabetes. And there are other medications like Wegovy, Mounjaro, Zepbound. The name can depend from another country to another one. So we have the doctors, as physicians, respect very carefully all the indication to give the better chances for people, because there are side effects, and it's very important to keep in mind that if you take this medication without needing it, you can have bad side effects. So that's why we keep saying, and we keep being very focused on them using this medication only in good indications for people who really need it, either people with type 2 diabetes or people with obesity.
And Emmanuelle, what we know so far is that there is no set time frame for how long patients can be on Ozempic. So would you say this is a forever drug? What would happen if millions of people stay on these injections for a long time? Is it sustainable?
Well, there are two problems. On the medical point of view, we are very reassured. Uh, Absolutely, because there are a lot of cardiovascular studies that shows that the long-term safety is good for people with type 2 diabetes. As it is more new to use them in obesity, we don't have a lot of long-term studies, but the recent ones we have are quite good, are quite safe. Of course, it will be very important, especially for old people, to manage the problem of the weight loss and the muscular mass. And of course, it will be very important to see how things will go for people who start very young and who will keep it. But I want to remind you that we've used this medication for almost 20 years. So it's not really a new medication for most endocrinologists, because it has been used in diabetes since about 2007, 2008. So it's not really a new medication.
Thank you very much, Dr. Emmanuelle. That was Emmanuelle Lecornet-Sokol joining us on Paris Direct.